hardly hit the first time round, many African countries now are confronting a much more severe wave of coronavirus infections. The Africa Centre for Disease Control says at least 20 countries currently have fatality rates higher than the global average of 2.2%. Speaking with me is Dr. Nkengasong of the WHO Regional Office for Africa. So, Doctor, how concerned are you about rising infections on the continent right now?
No, thank you very much, Mark. As you mentioned, the African region of the World Health Organization used to be or is still among the least affected region in terms of number of cases. However, since mid-September, we have seen a steady increase in number of cases in several countries. As of now, the peak we have now is even higher than the peak we had back in July. So that's of concern for sure in our region.
Much anxiety about the new variant in South Africa, where we've seen both cases and death numbers rise quite substantially over the last few weeks. Is it simply inevitable that this is going to spread throughout the Southern Africa region?
Of course, we are concerned that the strain will also spread to other countries around South Africa or even beyond. And so far, what we know is that this variant has been detected in a few countries like Botswana and Zambia. We can only expect that this could spread to other neighboring countries in Southern Africa for the simple reason that South Africa has a very close relationship and people movement between the countries, between South Africa and neighboring countries is very intense. In terms of epidemiology, what we know about the new variant, there are suggestions the new variant that was detected in South Africa has higher transmissibility. But at the end of the day, in terms of public health measures, they remain the same. That's why we are inviting countries that regardless of new variant or not, the public health measures that national authorities start implementing, they should be even emphasized in these countries so that we break the chain of transmission.
Now, Doctor, we know that vaccines for most people in Africa, as things stand, are probably some time away. And we also know that the kinds of stimulus packages that we've seen in the United States, in Europe, and the UK to support populations through the economic downturn are not available or are not necessarily options for African leaders. So that makes lockdowns particularly unpalatable and unfeasible for many African leaders now. What advice are you then giving to these leaders? What options do they have?
No, thank you, Mark. That's a very important question. So, indeed, many of our countries have suffered a lot. We can say maybe the region has been relatively spared by the virus, but the effect of the virus, especially on the economy of our countries, it has been devastating. So you are right. The choice for many of the African leaders is very tough. Is how do we prevent the pandemic from spreading in communities and devastating our health and our communities, and also at the same time not completely destroying down our economy. That's a tough one. So what we are suggesting is this. I mean, we understand that they cannot close or lock down the whole country forever. So what we are suggesting is it should be a risk-based targeted measure, not a blanket measure like, every country, every single person, every single province, every single area targeted by the same measure. I don't think at this point it will be very efficient.
Leading up to the second wave, it appeared that Africa, at least relative to some other regions worldwide, had generally fared better in the face of the coronavirus. Some people say that this had to do with Africa having much younger populations. Others have said actually these strategies against coronavirus were very successful. And then some others have actually said that because testing is quite low, that we simply don't know how far the virus has spread. What is your assessment of African countries' response to coronavirus so far?
Until mid-September, African countries did not so bad. It is true that at the beginning, all of us actually were really worried about the effect of the pandemic in Africa, because we know most of our countries, the health systems are weak, and we have some kind of social, cultural that could be conducive to an explosive kind of pandemic in our region. But that didn't happen. we think a combination of factors played a role. And one of them, of course, we have the population structure with mostly our populations are younger in many of our countries. But I believe personally that one of the factors and contributing factor, and I believe it significantly contributed, is the action taken by African countries. Such actions include, for instance, earlier on kind of lockdown and other public health measures at the beginning of the pandemic. For some countries, before even getting a single country. So I believe that also played a significant role. But of course, as the pandemic progressed in our region, we start seeing a kind of fatigue in the population. People could no longer adhere to public health measures. And as a result, we are seeing now this peak in terms of number of cases.
Dr. Nkengasong from the World Health Organization, Africa Regional Office, thank you for your time.
Thank you very much, Mark. Thank you for having me, and thank you for this opportunity.